Good morning, good afternoon, or good evening, everyone. We understand you might be tuning in to our program today live with us on May 8th, 2025. It is just about noon in the Eastern time zone. You may be also listening to this recording asynchronously whenever you feel like it. And if you are, we welcome you as well. This is Retain Kentucky's seventh and final entry in our Lunch and Learn series on return to work. We are delighted that you're joining us for this particular program. This program has to do with the role of healthcare providers in stay at work and return to work. And we are looking forward to this conversation with you all. My name is Phil Rumrill. I am a professor of counselor education and director of research in the Human Development Institute at the University of Kentucky. And with me today is my dear friend and esteemed colleague, Shirley Cron. Shirley, I know you are on the video. I am on the phone today. But because when we have folks on video, we do ask folks to give a visual description as a universal design matter. In the interest of equity, I'll give a visual description of myself just for the record, although I'm not vain enough to like doing that. But I am a 56-year-old white male. I have hazel-colored eyes. I am mostly bald. Today I'm wearing a blue golf-style shirt. I'm sitting before a nondescript color neutral background in my home office. My pronouns are he, his, and him. And Shirley, I had the great pleasure of being one of the investigators on the Retain Kentucky project. And it's great to have this opportunity to be here with you today. We enjoyed working together over the last 6 years, I guess, if we go back to the first phase, right?
Yes.
And we are glad to have you with us. And Shirley, would you begin with a visual description of yourself? Tell us who you are, please, and then we'll get rolling.
Thank you. Good afternoon. Welcome, and thank you for the opportunity to be part of today's presentation. I am Shirley Cron, and I work for the University of Kentucky's Human Development Institute. I am an older white female with short blonde hair and light green eyes. I work for the University of Kentucky's Human Development Institute. Since late 2018, I've been the healthcare lead for Retain Kentucky. Retain Kentucky is a U.S. Department of Labor initiative focusing on helping individuals with injury or illness stay at work and return to work. The program emphasized the strong use of universal design, assistive technology, peer support, and social determinant support to address stay at work and return to work barriers for participants. Thank you for joining.
Thank you, Shirley. And Shirley, you began 6 years ago. I realized early on you're the ultimate overachiever, and you've already covered most of the next slide, which is just our disclaimer and our acknowledgement. But just for the record, we do want to gratefully acknowledge the United States Department of Labor Office of Disability Employment Programs for their generous support of our Retain Kentucky grant. So our remarks today are supported by that grant and everything we learned in the furtherance of that particular project. However, we do want to offer this caveat that the perspectives and opinions that Shirley and I will offer here today are ours alone, and they do not necessarily reflect the policies of the U.S. Department of Labor or the priorities of our federal government. So we want to get that out of the way, and we have done that. So let's go ahead and jump in. Just a couple of housekeeping items. We have not on the video, but he has been before, our friend Ben Cook, social media and communication specialist with Human Development Institute. Ben will be advancing the slides for us. and Brandon Canada. Some of you have heard from either of these gentlemen as we've prepared for the program today. Brandon and Ben are providing the technical support for us, and we always appreciate both of your help, guys. So we're glad to have you with us. Brandon will also be monitoring the chat, so feel free to put questions and comments in that medium if you prefer. You can also, as we're talking, get our attention any way you like. You can unmute yourself. You can raise your hand using the electronic function in Zoom, or you can do so manually. You can throw something at the screen, however you'd like to get our attention. We're happy to hear your comments and questions, of course. We'll pause a few times throughout the program today for any input that anybody might have, and we will try to leave room at the very end for questions as well. So I think that covers how we will proceed. So Ben, if we're now on the third slide, that would be good. And this has to do with why is stay at work and return to work so important? So before we even get to the issue of health care, which will be the focus of the body of our remarks today, why is stay at work and return to work so important for people with disabilities, and in fact, people without disabilities as well? Ben, just a quick check. Are we on slide 3?
Yes.
Yeah, excellent. Okay, great. Well, we know that work is a very important part of life in every developed society and many developing societies. We know that work, what you do for work, is a very important part of your identity. What we do is, in large measure, who we are. If you think about when you meet someone you don't know at a ball game or at a party or a gathering or on the bus, usually the first thing you do when you introduce yourself, right, is that you say your name and ask the other person their name. And pretty soon after that, it gets to what do you do? What do you do for work? And when someone makes that statement, I'm a plumber, I'm an accountant, I'm a nurse, they're telling you what they do, but they really are also telling you who they are. And what we do and who we are really inextricably linked. And if you think about how much time we spend engaged in the pursuit of our work and our career development, estimates are that of working age adults, the average working age adult in America spends 60% of their waking hours too, 60% of all waking hours while you're awake, either working, traveling to work, traveling from work, thinking about work, taking a text or an email about work, somehow engaged in your role as worker. And in that regard, the average American spends more time actively engaged in the role of worker than they spend in any other role in their lives. We spend more time actively engaged as workers on average than we do engaged in our role as spouse or significant other, as leisurite, as friend, as parent, as citizen. So it's a big deal, not just because it's time consuming. We know that work is a very important conduit and vehicle to financial security. But our friends at the University of Minnesota remind us many, many times that work is not just a paycheck. In fact, there's somewhere around 25 things other than pay that people derive from work. We call these work reinforcers, and they involve all of these aspects, things like access to health care, to health insurance, primary vehicle to having coverage to support your health, to support health insurance. Therefore, having health insurance is an important conduit to health care. Access to health care then is an important conduit to overall and long-term well-being. So if you're receiving health insurance benefits from your employer, which many workers are, this speaks really well to your prospects for ongoing health. You have to maintain some modicum of health to be able to function in the workforce. And if you stay in the workforce, you tend to be healthier. What else do we get from work? all of the opportunities for social connections with other people. Think about how many folks you know who have made friends, significant others, and partners. That's where you meet people in the main. And the people we work with do become our friends and social networks. Opportunities for travel and advancement and the overall sort of identity formation, which is not a static concept. It changes over time. So we probably don't need to tell folks who have been to any one of our previous 6 return to work webinars that work is a big deal, but work is a big deal as it pertains to health, and the impact that work has on mental and overall health is very well documented. And as stressful as work can be sometimes, and as sometimes people occur injuries and illnesses resulting from their work. But there's no question, Shirley, that by and large, people who work are healthier, both mentally and physically, than people who do not. And I know you've got some information on that very reciprocal relationship between health and work as we dig more deeply into the nuts and bolts of what we want to talk about today. So Shirley, I'll turn the next slide to you.
Thank you, Phil. Why do we need to include healthcare providers in stay at work and return to work? As Phil said, work and health are deeply interconnected, influence each other in various ways. Employment and income have a direct impact on life expectancy, quality of life, and healthcare cost of individuals. Relatedly, health has a direct impact on employability. Acute and chronic illnesses can prevent work entirely, cause job loss, prevent wage gain. The healthcare provider is often the first point of contact for health concerns and advice for navigating work-related challenges after an injury or illness. They are in a key role in influencing the patient's expectations and helping them maintain their daily routine as much as possible. And for working patients, helping them stay at work or return to work as soon as it is medically appropriate. Both physical and mental health have a significant impact on employability. Healthcare and mental health needs have to be part of every step of the return to work and stay at work process. A significant part of every community faces health challenges that may impact their ability to return to work. Many individuals either experience these challenges themselves or they know someone who does. Take a moment and think about people you know, your coworkers, family, or even you, who have had to leave their job for health reasons. Did they come back with support or accommodation to their jobs? How did their physician support them in returning to work? We have seen firsthand how important it is for vocational rehabilitation counselors, employers, and healthcare professionals to work together to help individuals remain in the workplace. Phil mentioned earlier, work has such a ripple effect on our personal and professional life. According to the American Heart Association, workplace stressors can increase risk of heart attack and stroke. It's a potent reminder that work is extremely important to both physical and mental health. These issues are not left in the parking lot. They come with our workers to work, and their work stressors are not left at the job. They go home, and more we improve one, we improve invariably the other. Work is not a simple social determinant of health, but a meta determinant of health, because work predicts and extends into decisions around so many other determinants of our overall health and well-being. Far more powerful are those larger elements, like socioeconomic factors. If you look closely, all have some connection to work. Research has shown the value of investment and how the synergies of health and work does benefit both the worker and the organization. Good work equals good health. Now, Dr. Wormel is going to talk about the healthy workforce. Next slide.
Thank you, Shirley.
Yeah.
Yes, thank you. Thank you, Ben. And if we've learned nothing else, Shirley, in our Retain project, we have learned that employers really are embracing the concept of the healthy workplace. Employers know that having a healthy workplace is the right thing to do for many reasons. We'll talk about that in just a moment. But it really also is a necessity if employers want to keep a fully functioning workforce, and particularly with the well-documented shortage of workers in our labor market. Employers have to work harder than ever before to keep good workers working. And in order to do that, it has become incumbent upon them to demonstrate to their workforce that the workplace is indeed a healthy one. And I really like Shirley's point, want to underscore it here about the fact that work is both a predictor and a consequence of health, right? So if you are engaged in work, you're likely to be healthier than if you're not. If you're healthier, you're more likely to continue in your employment. And so that reciprocal, cyclical, circular relationship between work and health, you can't pull one out from the other. And that's why we're talking about them here in this particular context. So just a few reflections on the healthy workplace. We would suggest to everyone here that a healthy workplace is one that is safe, both psychologically, emotionally, and physically. Shirley mentioned the impact of stress on the job and feeling that you have a safe space at work. You belong. A healthy workplace is one where people feel a sense of belonging and a sense of purpose. A healthy workplace is one that promotes the health and wellness of all workers, because the company, the organization works better when all of those factors are in place. That health concerns are dealt with both proactively and reactively. A healthy workplace promotes people's personal as well as professional development. A healthy workplace is one where the worker has input and indeed control over how work is done at times, where work is done, the decisions that are made, etc. When workers are involved in the decisions that affect them, things work better, and the perception of overall health and well-being in the workplace is increased. I alluded to this earlier, but we have found in our Retain Kentucky project and research for many, many years now, it might especially be true in the COVID-19 pandemic, but maintaining a healthy workplace is not only a legal imperative for employers, it is also a moral and an economic imperative as well. So there are legal requirements that require, of course, that make employers have to attend to workplace safety and responses to injuries and illnesses in the workplace. There's a growing sense that providing for the health and welfare of your workforce is simply the right thing to do. But by following the law and by doing the right thing, you're also improving your company's bottom line, because you're reducing turnover, you're reducing absences and time lost from work, you're reducing the overall cost of disability in the workplace, and you are promoting the economic health, not only of your organization and your community, but of society as a whole. Healthy workplace is one where the work is challenging. It is fully accommodated and for people who need it, and a healthy workplace is one where people are compensated fairly for the work that they do. Healthy workplace also, and I think this is really important, and surely this speaks to mental health, of course, but also to overall health and safety. One where social relationships and friendships among workers are actually not only permitted, but encouraged. The workplace ends up working better in every way there is, on every measure, when people get along well, when people see the workplace and the opportunity to work as a way to connect with others. It's human nature to want to do that. And with the amount of time we spend at work, if there are ways of building in the social connections that are available there at work, so it's not just professional development to advance your own career, are you having the opportunity to engage with others, for shared purposes makes the workplace healthier when that is in fact the case. Surely we could go on and on about the healthy workplace, but we won't, because we want to get to specifically when we start engaging the healthcare providers in the stay at work and return to work process. I guess we better get to fairly soon, Shirley. Who are we talking about?
Okay, next slide, please. Well, one scan of this rather imposing list demonstrates why people need help to navigate a complex maze of healthcare and job-related options at a time when they're struggling with their healthcare needs. Not all of these team members will be necessary for every return to work process, and conversely, special circumstances may involve other experts. For instance, a rehabilitation of a brain-injured patient may involve an extensive hospital-based team. But return to gainful employment is viewed as one of the most essential outcomes in disease or injury treatment. So it's important for our healthcare providers to work with their patients to ensure a successful outcome. We talked about earlier the importance of the collaboration among vocational rehabilitation professionals, healthcare providers, the employers, and the workers themselves for effective return to work. Nurses. I'm a nurse by training. They represent the largest of the healthcare group, and the involvement of nurses in return to work, stay at work practices is crucial, especially in rural locations, as nurses are often the primary source of medical care for patients. Mental health conditions are common among working adults and can significantly impact a patient's ability to remain in the workforce or transition back after an illness or injury. So by integrating mental health support into treatment plans, physicians can improve patient outcomes and enhance overall workforce retention. And just a few words about telehealth. We saw significant disruption to hospital services, surgeries, access to traditional care for millions of injured workers during the COVID-19 pandemic. The industry looked to telemedicine, telehealth, and digital coaching tools to assist workers in new ways. And we still see that happening today. Specialty providers like orthopedic surgeons adapted by conducting pre-op, post-op visits remotely. Physical therapists became adept at conducting sessions via video connections when practical. So we see this long list of healthcare professionals that we will be working with throughout our Retain program. Phil, I'm going to stop for any questions if we have any in the chat, or if you would like to add any comments.
Thank you. I'll wait to hear if there's any questions.
No
Anybody?
questions in the chat.
Excellent. Shirley, really appreciate, I mean, you can't have a conversation about healthcare return to work, can we, without talking about telehealth, and of course, the advent and just incredible proliferation of information and communication technology, just how we're conducting this webinar today, right?
Yes.
Hybrid of video and audio with a group of people. I mean, look at how many people had to shift to remote work during COVID-19. Some of them have come back to the office, some of them haven't, and then not being able to access healthcare. So I think communication technology and how we do business, both as a society and in particular in the healthcare area, really some tremendous innovations occurred by necessity, which is how most innovations do occur, during COVID-19. And so we still just continue to struggle with just the unprecedented calamity that the pandemic was and continues to be. But look at some of these things that have grown from it, and some just incredible development. And just want to underscore that in the way of service delivery, but also the very nature of how healthcare is provided, and also the very nature of how work is done. So it's really apropos, Shirley, of of this conversation about healthcare and return to work, no question.
There are some silver linings to the COVID-19 pandemic.
For sure, and we hope more will be coming, right? Unquestionably. Fair enough. Want to go on to the next slide then, or Brandon? Anything else? Has anyone?
And I think this is yours, Bill.
Yep, we're all
Yes,
good.
I got it. Yeah. So let's take a look broadly, and this is going to organize much of the rest of our program today. We want to talk about the quadruple aim of the healthcare system. The quadruple aim, that's a mouthful, but I think what that means is that there are 4 elements to the way healthcare is provided and organized in our society. Many experts have conceptualized the priorities in healthcare today in this way. Many professional organizations, such as nursing and medical associations and large healthcare facilities, have embraced this notion of the quadruple aim, Shirley, which I understand used to be the triple aim. But let me share with you these 4 cornerstones of the overall purpose and mission of the American healthcare system. And then Shirley's going to break these down by applying each one of them to stay at work and return to work. So just very quickly, first part of aim 1, improving patient experience. And more on that soon, but this, you get surveys more than you ever did when you go to the doctor. We increasingly, we know that outcomes are better if patients feel that they've had a good experience with their provider. That's an oversimplification, but Shirley will share more on that. So improve patient experience. Number 2, improve population health. If we don't want to do that, then what are we in the business for in the first place? So we want the overall population, everyone in our society, particularly those people who are the most vulnerable, to have the best access to healthcare that they possibly can. So this gets to outcomes, it gets to equity. We want our overall society to be healthy, and healthcare has a tremendous, of course, role to play in that. Not surprising to anyone, I'm sure nowadays, we want to reduce the cost and increase the return on investment for healthcare services. An ongoing situation. We have to deal with these issues all the time. Certainly COVID-19 brought a lot of this to the fore, but reducing costs and improving outcomes really at the same time creates sometimes some very unique challenges. Somewhere along the way, Shirley, I guess that healthcare facilities began realizing that as far as their engagement with the disability community, they not only were providing services to patients, but they're also very large employers of people with and without disabilities. And if you're a large employer, and we know that about 20% of all Americans have disabilities, then a good share of your workforce is going to be dealing with disabilities or may at some point during their careers. And so the 4th leg of the quadruple aim of healthcare has to do with improving the well-being of healthcare providers, staff members, people who work in the healthcare industry. So it's the role of the healthcare provider as an employer, often some of the larger employers in the communities where they operate. And so it really goes beyond patient services and patient care and community health. It also gets to how do we function as employers of workers who may need accommodations as well. And so if we're involved in stay at work and return to work, and Shirley's going to get to this in just a moment, we have to be cognizant of the entire 4-tiered aim of what our healthcare system is all about. Right, Shirley?
That's right. And at the very core, it is about improving patients' lives. Next slide.
Okay.
We're going to look at how do stay at work, return to work strategies align with each of these quadruple aims. And I'm going to start with improved patient experience, because healthcare providers have the unique opportunity to challenge misconceptions about workforce participation and reshape how individuals are supported in the stay at work, return to work process. Expectations about work and a person's capabilities, or assuming that they cannot work, can create difficulties around employment. To better understand their specific challenges and accommodation needs, healthcare providers can include asking their patient if they have concerns at staying at work or returning to work as part of their usual exam. This can foster a welcoming and flexible approach to improving patient engagement and trust. Making time to listen to patients' concern and actively addressing their needs will ensure they feel heard and valued. Developing a return to work plan with the patient at the center and being willing to adjust that plan based on the patient's progress and any unforeseen circumstances will show flexibility and understanding. Improving access with regular follow-up appointments in a timely manner. Everyone will experience, as Phil said, impairment at some time in his or her life. So having healthcare facilities that are physically accessible benefits everyone. When offering referrals and resources, we have to have providing timely support for specialty care referrals, physical therapy, or occupational therapy to help patients achieve their return to work goals. And finally, acknowledging that returning to work can be emotionally challenging and provide resources or referrals to support mental health and well-being. Next slide. We're going to talk a little bit about improving population health, and that was really at the core of the original triple aim, and realizing that improving population health was only possible if you could impact achieving patient experience and reducing costs. We know the sooner a patient is engaged in stay-at-work, return-to-work planning, the better the chances of a smooth recovery and successful return to work. Critical is the case management strategies of integrating medical and vocational case management and coordination of services among all the stakeholders, whether that's the worker, the family member, vocational specialists, the healthcare provider, mental health systems, insurance companies, and employers. Managing social determinants of health is a significant focus in today's value-based healthcare landscape. Individuals facing socioeconomic challenges, such as unstable housing, financial insecurity, or lack of access to transportation, may struggle to adhere to treatment plans, attend medical appointments, or afford necessary medications. Additionally, stressors related to work environment, job satisfaction, or lack of social support can impede the progress and prolong recovery timelines. Addressing these non-medical factors that influence health outcomes and encouraging peer support, resource utilization, and full community participation is key to worker recovery. Phil, before I go on to reducing costs, would you like to add anything?
Shirley, I just wanted to underscore the importance of, what you referred to earlier as the social determinants of health. As we think about helping someone through the process of recovering from an injury or illness to get back into the workforce, there's all of the things that have to happen with their care and the acute aspects of their condition. We have to understand what's happening in the workplace, right, and the job they have and their own capacities to do that. But I think we found in Retain Kentucky, Shirley, don't you, that
Yes.
what really determines the ultimate outcome for folks is whether the circumstances in their lives permit them to get back into the workforce. It's partly about the good supports and services we can provide, but it's partly about, do they have access to childcare so they can go back to work? Is there a transportation situation? Do they have a reliable vehicle so they can go back and forth to work, or access to public transportation? Where housing security may be an issue. And surely I'm thinking of many of the participants in Retain Kentucky we had who were homeless, and we were trying to help them find jobs. And when you fill out a job application, it says, what is your address? And what if you don't have an address and you can't enter, or you don't have access to technology in the first place, so it doesn't matter about the online application? Or if there are issues with your utility bills, or because you've been out of work for a long period of time, issues with paying your rent or your mortgage, whatever it might be, food security. We learned a lot about this during the COVID-19 pandemic as well. And as we're doing the direct connection between the person's health and their job, we've also got to take into all of those other factors. And surely I think this comes under the population health umbrella, more than anything else, but understanding the other things that are going on in people's lives, because if we don't help to get those things in place, roughly stated, it doesn't really matter what kind of match we make. We can help someone with any manner of return to work or stay at work, but if they simply can't get to work for one reason or another, then all of those efforts really do go for naught. And so we have to attend to those. And you've emphasized this in all your work in retain. I just wanted to underscore that. I didn't mean to go on such a long tirade about it, but it's so very important.
Yes, and so very true, because a person's impairment may not be the biggest barrier that they're dealing with.
No doubt, no doubt.
Moving into reducing cost, in a stay at work, return to work strategies and aligning with this reduction of cost, we know many ill or injured workers could remain in the workforce if they receive timely, effective help. Research tells us that the longer employees are out of work, the less likely they are to return. So return to work programs intervene early to prevent minor injuries from evolving into chronic conditions or long-term disabilities. Shorter periods of time off work means less need for doctor's visits, prescription medications, and potentially less need for longer-term or more specialized treatments. Getting patients back to work sooner can reduce healthcare costs by decreasing the duration of lost work days, which in turn reduces the need for medical and disability benefits and potentially lowers the overall healthcare expenses. Early return to work initiatives can also improve employee health and well-being, further contributing to cost savings in the long run. Remember, good work equals good health. So for employers, return to work programs help mitigate hidden costs such as hiring and training new employees to replace injured workers, overtime pay for covering shifts, and productivity losses from reduced workforce capacity. Next slide. How do stay at work and return to work strategies align with the improving provider well-being? Well, while progress has been made in recognizing the importance of supporting individuals in their return to work, challenges still remain in addressing healthcare disparities that affect employment outcomes and gaps in physician training related to employment-focused healthcare management. We will be talking later about a provider handbook as a key educational resource in assisting healthcare providers in discussing returning to work as a health benefit for their patients. Increasing stay at work, return to work competency through training and education can lower healthcare providers' stress and reduce feelings of frustration and inadequacy. This leads to more effective communication, improved patient outcome, and increased confidence. For healthcare providers who do not specialize in occupational medicine or physical medicine and rehabilitation, return to work practices often are not a focus in their medical training. This leaves many healthcare providers unaware of its importance. Getting return to work specific training can be difficult for healthcare providers working in large healthcare organizations, where continuing education is often limited to topics the organization selects as important. Limited focus on work-focused healthcare management occurs in medical and nursing school training as well. And often in rural areas, nurse practitioners are the first point of contact for injured or ill workers, so including them in all training is key. Thank you. Next slide. We're going to talk just briefly about how do healthcare providers support patients in returning to work. Healthcare providers are encouraged to simply ask their patients about their work. Early healthcare and vocational intervention minimizes the barriers to work that injuries and illnesses may create, all in the interest of reducing the number of lost days of work and the prevention of disengaging from the workforce. It's essential to shift the focus to what a patient can do rather than what they cannot do, ensuring that individuals receive the support and accommodations needed to succeed. The healthcare provider's documentation ensures that both patients and employers know what is medically appropriate and realistic to expect the worker to do. The healthcare provider's role is to assess the functional capacity of the patient, develop a treatment plan with the patient that includes stay at work, return to work, and encourage communication among the patient, the employer, and other key stakeholders as appropriate. If a job description is not available, the patient may be the expert in their job duties and the essential functions of their job. Instead of simply determining if a patient cannot work, the healthcare provider assesses what aspects of their job they can still do and will suggest temporary modifications if possible. They can recommend minor changes that allow employees to stay productive, such as flexible schedules, assistive devices, or alternative duties. By increasing awareness around universal work design, assistive technology, and reasonable accommodation, healthcare providers can help bridge the gap between medical care and long-term employment success for their patients. Encouraging patients to return to work can be their best medicine. Remember, work is a health outcome. We have a nifty quick reference guide as part of the provider handbook that I mentioned earlier for practical guidance to the provider in their daily practice. And I want to share just a quick success story around Lisa, who's a nurse who tells her provider that she will need to take extended leave as she cannot lift patients or start IVs due to her restricted wrist movement from an injury that happened result of a fall at home. Immediately, instead of approving time off, her provider takes a problem-solving approach. She assesses Lisa's abilities, suggests temporary modification. Instead of patient lifting, Lisa could assist with patient education, charting, or triage responsibilities, tasks that do not require heavy wrist movement. As a result, Lisa stays engaged, continues to earn income, and avoids unnecessary work absences. I'm going to pause here to see if anyone has any questions or comments. Okay, we can go to next slide. We've been talking about Retain Kentucky and what are some best practices involving healthcare providers that we took in stay at work and return to work. From the beginning, Retain Kentucky recognized the powerful role that healthcare providers can play in their patients' decisions and abilities to return to work. By enlisting local healthcare champions to join and advocate for the Retain Kentucky program at a direct and system level, Retain Kentucky began building and expanding a collaborative network of healthcare partners engaged in return to work and stay at work best practices. From the direct service perspective, Retain Kentucky worked with healthcare providers to identify people who had experienced illnesses or injuries outside of the workplace who could remain in or return to their jobs as soon as possible through early intervention strategies. This outreach gave Retain Kentucky access to early identification and recruitment of a targeted patient population. Additional element of continuous quality improvement was achieved by providing the return to work coordinators through Retain with the opportunity to consult with the Retain's medical directors. Healthcare partners included Kentucky Hospital Association representatives, as well as senior leaders in human resources, population health, occupational medicine, and physical medicine and rehabilitation. One of our healthcare partners, a senior leader in population health, provided a dual perspective as a provider and an individual with a disability. In all, the healthcare champions represented 5 healthcare systems that employed over 50,000 workers. I'm going to pause and see if you have any questions or comments. Phil, would you like to add anything? No, you were intricately involved in this as well.
Well, Shirley, it just strikes me how you and our other colleagues it's not the right word, but infiltrated the entire healthcare system and brought this more than just the rhetoric of stay at work and return to work, but not why, because I think they're already on board with why we need to do these things, but how, and putting the action verbs into that, really by engaging leaders in the healthcare field throughout the Commonwealth of Kentucky, and the large facilities and healthcare concerns really did resonate right from the beginning, I think, Shirley, with their dual role as providers of patient care, but also as employers of large numbers of people, and some occupations, such as nursing, which is known to be very hazardous on the back, right, and large numbers of musculoskeletal injuries because of lifting requirements usually. Large numbers of employees who may need accommodations or may have to enter the stay at work or return to work process. And they really, they got that, but it was done with an awful lot of elbow grease and making those connections. We didn't leave too many healthcare constituents out of this grant, and that's a testament to your work and your leadership in getting this all rolling. So we're grateful for that.
Thank you. Thank you. Let's move to the next slide. These healthcare champions I mentioned collaborated with Retain Kentucky outreach staff to educate other physicians on their potential role in the return to work, stay at work services. They participated in face-to-face planning, implementation meetings with project staff, the development of project promotional materials, the promotion of Retain during their grand rounds and monthly department meetings, and the development of training programs for healthcare providers. On a system level, Retain Kentucky focused emphasis on program sustainability and enduring statewide change. Formal healthcare champions also advocated for the inclusion of Retain Kentucky in their healthcare system's electronic medical record. This integration was a necessity due to the challenges in accessing physicians and hospital staff during the COVID-19 pandemic. Physicians could refer directly into Retain, resulting in a return to work coordinator reaching out to the patient to provide program information, obtaining consent, and arranging the project services. Within nursing and social work, practitioners were trained to incorporate Retain referrals into their discharge practices. Furthermore, the electronic medical record system patient portal allowed patients to self-refer to the project. To address the gap in physician participation in the return to work, stay at work process, Retain Kentucky went to the champions, and these physicians aided Retain in recruiting participants for the program and building connections for information partnerships to better serve participants. They were also recruited to share their experience and perspectives as members of the Inclusive Worker Health Leadership Network. Retain Kentucky partnered intentionally with 2 academic healthcare systems and their providers, intending to reach systems that not only provide clinical care, but also offer education and training for the next generation of providers. Continuing medical education, CME, was developed through collaboration with physician champions at U of L Health, the Kentucky Nurses Association, and an occupational medicine provider. The course is designed for a variety of healthcare fields, including physicians, physician assistants, medical assistants, nurses, physical therapists, occupational therapists, and speech therapists, all with continuing education credits available for their respective disciplines. Medical residents and students were also included in the retained practitioner education efforts, demonstrating another strength of Retain Kentucky's involvement in the academic medical system and the ability to really impact the practice of future healthcare providers. Retain Kentucky also offered monthly webinars for employers with guest speakers who educate attendees about various topics regarding disability, injury, illness within the workplace. Several of these webinars were led by healthcare professionals, allowing employers the opportunity to consult with healthcare professionals who have experience in the return to work, stay at work process. I'm going to pause here because Dr. Rumrell was very much a part of our Retain series that we did for the Kentucky Nurses Association. And those 3 continuing education offerings are evergreen and are currently in an on-demand status. We have running 600 practitioners across Kentucky that have taking that continuing education. And Dr. Rumrell, would you want to add a little bit about what we covered in those 3 sessions?
Yeah, that was a great opportunity, Shirley. And right from the beginning, we we knew that the nurses are often at the very front line of all of the issues that end up bearing on stay at work and return to work, right? I mean, you spend more time engaging with the nurse or the nurse practitioner than you do with your physician many times, depending on what's the nature of your health situation. And nurses understand the function. They understand all the medical aspects, but they also understand the community living part. And I don't mean that other providers don't, but it's a very important link, and particularly perhaps the occupational health nurses, they're already on board with stay at work, return to work kinds of considerations. But we found the nurses to be really amenable to this content, and they shared their own perspectives. Very, very helpful. In this one, our first one, as I recall, Shirley, had to do with the impact of the COVID-19 pandemic on the disability community, on our economy, on how work is performed, some of the things we alluded to earlier in our remarks today. So we started there, just casting the notion of stay at work and return to work in the present context, you know, and the public health situation that was caused by the pandemic was just simply unprecedented and just a game changer in every way that there was. And so even though our project, you know, was not really about COVID-19 per se, anything you do during COVID is about COVID, right? During this era, it simply is,
Right.
And you have to deal with that. And so the impact of the pandemic on the disability community, on employers, on healthcare providers, et cetera, was the first program. And people seem to resonate with that, have a lot of questions and perspectives from their own experiences, which really helped us, I think, in sort of moving forward in our own dissemination efforts and things of that nature. Then we really doubled down on the universal design, workplace accommodations, and assistive technology. And this is a program that our own Dr. Shepard-Jones and Christina Espinosa presented for us just a few weeks ago. Some of you may have tuned into that outstanding presentation. You just can't say enough about how we design the workplace to make sure that all of our stay at work and return to work efforts can actually, you know, bear fruit, are the accessibility features of the environment such that the person can succeed. And surely we didn't leave out the notion of workplace of universal design and the use of technology in access to healthcare, because that's an issue too, right? If you can't physically access the healthcare facility, or you don't have the technology available to do the telehealth, particularly during COVID when you couldn't get in to see your primary care physician, you're really at an extreme disadvantage. So we had to deal with this issue of universal design, and nurses really seem to resonate, with that as well. And then finally, we opened the whole Retain toolbox, the stuff that Shirley was talking about in these 2 slides. We did a whole presentation on the entire Retain Kentucky intervention, how we did it, how we engage healthcare providers, and how nurses can continue to be involved in the stay at work and return to work enterprise, even if occupational health is not their primary practice domain. So it was a really good sequence, I think, but even more than that, surely it was the buy-in from the Kentucky Nurses Association and all of the nurses who joined, and the questions and comments and things people shared with us. I mean, I learned a lot more from the audience than they learned from me, no question about that. And it brought a lot home in terms of what we're doing. Sometimes it underscored the stuff we've done, and sometimes it caused us to reflect on why we did certain things and whether next time around we might do it differently from the point of view of people who really are in the front lines of healthcare. So that was a great program.
Yes, it was. And they were especially interested in the emerging disability, as you mentioned, the very first, because that was very near and dear to their heart. That was the majority of their patient population. And so it was very relevant to them. Well, finally, I want to talk just for a second because we're nearing the end of the presentation, but Retain Kentucky has developed a series of handbooks which will be available to workers, healthcare professionals, and employers. The employee in healthcare provider handbook has been reviewed and provided input by physicians and nurse practitioners for the handbook. The goal of this handbook is to empower healthcare providers to discuss returning to work as a health benefit with their patients, recognizing work as an expectation for everyone, and incorporating this resource into their practice. Beyond medical treatment, the healthcare provider's role extends to empowering patients to advocate for themselves in the workplace. By helping them use modifications and assistive technology, they contribute to a more supportive and productive work environment. These strategies not only benefit individual patients, but also strengthen the workforce and enhances community well-being. An effective return to work strategy improves health outcomes, enhances financial stability, and strengthens the healthcare system by supporting both recovery and long-term success. When healthcare providers actively engage in return to work planning, they help create a more robust workforce, ensuring that individuals can thrive despite medical challenges. That is the end of our presentation. I think we have a few seconds, a couple of minutes for questions if anyone has. We appreciate your time and commitment here. And please, as the slide says, reach out to Dr. Rummel or myself if you have any questions or comments.
Shirley, thank you for taking time to visit with us. And it strikes me, all good things must end, right? Just like this presentation, our Retain Kentucky grant just recently ended as well. This is the 7th and final installment in our Lunch and Learn webinar series. So a lot of things coming to a closure right now. And Shirley, as sad as it makes me to think about our Retain project ending, I'm more so, I'm glad that it happened. I mean, we had a great run and a great ride. We learned a lot. I'd like to think we did a lot of good for a lot of people, and getting to know folks in the healthcare side and the employer community and bringing that together really did prove to be a very powerful intervention all the way around. And it's really gratifying, Shirley, to be talking about it now that it has ended, in a summative sense. You know, for years we're talking about what we're going to do, then it was what we did do, what we were doing, and now it's what we did. And we look back on that, and the long-term impact will be, is still going to be unfolding but you made some just incredible inroads with the healthcare community in Kentucky, and those don't go away with the end of a project. Those are enduring and a great testament to the work that you and your team did. So grateful for the opportunity to work with you.
Thank you, Phil.
And folks, thank you for joining us on our Lunch and Learn webinars. We hope to engage with you in other programs of the University of Kentucky's Human Development Institute. We want to close by thanking you for everything that you do to help members of the disability community achieve their goals and realize their dreams. So we want you to keep doing what you do, and we want to suggest that you don't ever think that it doesn't make a difference, because it does. Be well, everyone, and thanks for joining us.